Welcome back, guys. So now we're going to start talking about some of those course outcomes that I was mentioning. So quality measures is the first one, which I know this one can be a little confusing, especially if you're new to the hospital system. But I really like this website. It's from the Centers of Medicare and Medicaid, which are they're the guys who kind of put forth these quality measures, right? So it's just getting started with quality measures, and they have these frequently asked questions. So what is a quality measurement? It's basically how do we measure quality, right? Like, how are we measuring our care quality, our quality of the care we provide? And the reason that we do measure it is because if you can't measure something, then how do you know you're improving on it? How do you know you're getting better? And so that's why we go for these methods that we do measure. And so here's some examples of quality measures, right? Might be for a specific population, might be for a specific unit, might be for a specific clinician or healthcare service that's provided, and they're trying to get that quality of care. And so what we're measuring is a few different things. So whether it's the patient outcomes, like how their health is turning out, the processes that we use, our patient safety, so this would be big ones, like our fall risks and our rate of falls, efficient use of resources, so again, are we being cost effective for our patients, coordinating the care, and patient engaging in their own care and their perceptions of it, and then like population public health. So again, these are kind of some of the bigger concepts that we're getting towards. So like health outcomes, right? Like, how is your patient progressing with their disease? Is it getting better? Is it getting worse? Are they on more medications now or less medications now? How's their quality of life? So these things that we can kind of measure and actually put towards, okay? This is more if you're getting into quality measurement in the hospital itself. So this next part of your project, I want you to relate the thing that you found in your research, okay? So whether it was yoga or whatever intervention or research that you found, I want you to relate it to some form of a quality measure. Did it improve health outcomes? Did it improve patient quality of life? Did it reduce costs? It could be a few things, right? Like yoga, that's a cheap intervention. You're actually being very cost effective for your patient in that they might be on less medication now, or just the intervention itself is cheap. Is it allowing the patient to engage in their own care? Is it helping with specific populations? Again, try your best with this one. It is kind of I know it's kind of a harder topic, but I'm trying to break down basically what a quality measure is and how we can relate that to some of the evidence-based practice that we're finding. So these articles that you're finding.